So hello everyone, I'm Dr. Riddhi. I'm the critical care faculty at Marrow. You would be knowing me. So today we have another topper with us, Dr. Saumyarup Pal. He is done his MD in geriatric medicine from AIMS, and he has now secured rank 1 in hospital medicine and critical care, and he's going to pursue the same at AIMS Rishikesh. So huge congratulations, Saumyarup, from me personally as well as from the entire Marrow team on securing the first rank. Obviously, we would like to know more about your journey and your preparation as well. But first, it would be probably good for the viewers if you could just introduce yourself as well as tell us about the training that you have received till now.
Good evening, sir. It's a very fanboy moment for me because I always looked forward to your career and all so that I could get an inspiration. And now I am here for an interview, and that's very surprising. But at the very time, it's very pleasing also. So I did my MBBS from Arjical Medical College, Kolkata, and then did my MD Geriatric Medicine in AIMS Delhi, and then uh, there were some crossroads in my life. For example, when my grandmother was admitted in one of the critical care units in my city, being from a peripheral medical college background, I had no idea that she would survive. She had an AKI, COPD, LRTI at that moment, and uh, from our background, it was like maybe we would lose her by default. But then there was a consultant and the critical care team who took very good care of her, and to our surprise, she was discharged. And that was a very striking moment for me. And then I took geriatric medicine. But also, that was also a good thinking point. Critical care medicine would be such an impactful uh, thing in our life. And in my course of MD, we had an HDU. Also, we had pulmonary ICU postings. And during COVID, you also know how much good AV8 ICU is, and also trauma center ICU is. I got posted in all of them, and also emergency medicine in AIMS Delhi. It's so good. So I got exposed to a lot of critical care residents and consultants, and they were so amazing, so amazing. So I developed my interest gradually and very strongly. So I wanted to pursue this.
Perfect, perfect, excellent. Obviously, like when we were doing MBBS at that point of time, critical care was like so at the initial stages. So we didn't really have much exposure when we were doing our MBBS or something.
Yes, sir.
Only during the later course of even with the same with me, even when I was doing my post graduation, then only I got exposed to critical care as a specialty. So why did you choose this hospital medicine and acute care? Because to my knowledge, this course has been there only for the last 2-3 years, and I think AIMS Rishikesh is the only institute that has started with this course, to my knowledge. So why did you choose this over other specialties? Like you could have also opted for critical care, but why did you choose hospital medicine and acute care?
Because at this moment, geriatric medicine is considered to be at nascent stage, and we don't have very much opportunities. I also applied for like for not for DM, for other courses uh, which are not MCI enabled, but they were like certificate courses which don't offer that much prospect in life. But I was very interested, and also at that same time, I got to know about this course from some residents who are working. One of my seniors are working there as a junior resident. So he told me about this course and the training and stuff, and I got to know that it's a very well equipped ICU as a medical ICU.
Right.
So I also got interest, and I also interacted with 2 or 3 of their residents, and were also knowledgeable, and also I thought that I could follow their footsteps.
Mhm.
One
So,
is we don't have uh, one
uh,
is we don't have much option, and second is I had interest.
no, I think it is a very good option that you've chosen. The reason I'll tell you that because if you go to the West and if you work in the Western setup, usually the internists or the internal medicine people, they're also called as hospitalists. And since
Yes,
you
sir.
are kind of from a medicine background, geriatric medicine again is like core medicine. except that you are probably looking after a slightly older population. So I think that way this is a good combination for you, because you will not lose touch with your basic medicine that you have learned till now, and obviously along with that you can develop your critical care interest as well. So I think it is a good option. It's just that I wanted to know how you actually thought about this option as an option, because again, not many people know about it, and maybe once they see your interview, a lot of other people who are maybe in your position, they also get inspired to do the same course, right? So I think it's a good choice from your part. So what I would now like to know, obviously now that you've told us about the background, how did Marrow help you in the preparation, both from the uh, critical care aspect as well as from the medicine aspect, right? So how did you actually decide that you're going to prepare for this exam, and then how did Marrow come into the entire picture in terms of helping you?
Okay, actually, this is not the first time I'm appearing. I appeared for it in the last season also, but that was like out of inquisitiveness. And
Right.
I actually love the book Washington Manual. I have read it cover to cover, to be very honest. But then when I appeared for the exam, no, I found that more questions were from internal medicine. Proper Harrison-based questions were there, and also acute care questions which were based on uh, Harrison. I also took Marrow once before, but that was for my final entry, so that I could gain knowledge and I could enrich myself. But that was not for any competitive reason. After this last time, when I was a little bit accustomed with the pattern, this time I prepared myself very strongly. Last time I was not motivated, but this time I studied hard and went through as much Marrow video as I could do. I had a very hectic schedule, but when I got back, I tried to watch all those videos, spend 4 to 5 hours per day with Marrow, with different resources, and then I solved all the modules of all those short tests that were available in the app. I solved all of them, and I completed almost 60% of the question banks. They were very good actually, and I got common from them also. Like 8 to 10 questions were from those topics.
Right.
Marrow was a very impactful thing.
Right. No, because I also feel like when you look at the NEET SS pattern, there's a lot of overlap. Even if you're appearing for critical care, or for, like, yesterday I was interviewing somebody who qualified for acute care. So there's a lot of overlap of medicine, internal medicine, and also
Yes,
critical
sir.
care, right? So you kind of need to, at this point of time, if you want to clear one of these exams, you need to have a kind of a global outlook, not just restrict yourself to one particular specialty, even if you're appearing for that particular specialty. So, but how is the exam distribution for this hospital care? Like, is it all internal medicine, or a mix of, like, how, if you have to give a percentage? So how much is internal medicine versus how much is acute care or critical care? How is the distribution of questions in the exam?
Um, uh, the last time question pattern was very different from this time. I'm being very honest. Last time it was like among 80 questions, maybe 30 to 35 questions were from chapters that are native to Washington Manual, like acute care and all. There
Right.
were general questions about management of hypertension, dyslipidemia, and then there were tricky questions, but they were not from any acute care medicine. They were from other chapters also. But this time, 50% was from acute care and critical care medicine. There were questions from ACLS, BLS. There was one from ACLS protocol of pregnancy. There were questions, 2 questions on ARDS, fluid management, then inotropes. Then there were questions on the surviving sepsis bundle, pain scales. There were questions on acute liver failure, HRS. Uh, Endocrine questions were there, 4 to 5. They were mostly on cortisol, one on diabetes, and I don't remember the other rest. Cardiology, arrhythmia, and uh, heart failure questions were there. And ILD was also asked in 3 questions. One was a trial also on Ninja Danny.
So, like, obviously, you mentioned about Washington Manual. So obviously, also feel that it's a very good resource. It's like a small book, but filled with a lot of information.
Yes, sir.
And I think it's a very good resource, especially when you want to revise all your critical care in a very limited span of time. It does carry a lot of this thing, maybe even more than a bigger textbook would have in terms of its impact. How did you find the critical care resource that Marrow had to offer? Like obviously I have the videos, and obviously then there's a lot of MCQs as well, right, from critical care, which is being prepared by the team. So did the critical care portion of Marrow help you in your quest towards this seat?
See, to be very honest, as I told you, it's a very fanboy moment because while working in ICUs, if I add up, I worked like almost 1 year in ICU in my total MD course. And then I had some questions in my mind which we couldn't find in books. You already cleared it without asking. Like, I didn't have to ask you, you already mentioned it. I think you have covered all the lacuna of knowledge we have in these books. And it was very precise that when I had to revise, then I looked at whatever notes I took from your videos, and I think they fulfill your knowledge, our knowledge also, and uh, they were most of the topics were discussed in the class.
Right. No, actually, when I do the videos, my aim is not just to like make sure that you guys clear the exam, because anyways I cannot predict what the questions are, to be honest with you. But my aim is that at least you have a good knowledge, so that at least even if you are not able to clear the exam, even if in your daily practice, it should help you, right? So at least that
Yes,
clinical judgment should be there once you have gone through a particular topic, or the clinical knowledge. That is the aim at the end of the day. So
yes,
if it
that is very clear, sir. For example, for MDR infection, especially for management of shock, I think I have grown better when I started seeing your videos only. They came in the exam, that is a different issue, but for my daily practice, it helped me, to be honest.
Right. So the other thing I wanted to ask you was obviously like when you were preparing for exam, like you mentioned, you have a textbook, you see the videos, and maybe you are doing the MCQs as well. So for the last 1 or 2 weeks, that we commonly refer to as the last minute exam preparation, what did you do differently? Or did you just focus on revising versus did you have a different approach in terms of the last weeks prior to the exam?
Actually, for the last 2 weeks before exam, I had a very tight schedule, but I had a lot of handwritten notes in my iPad. I made all those notes throughout my MT career, and I also made a separate chapter where I would see your videos, and I also used three other resources. I should be very honest. One is
Mhm.
one book by Sandeep Maheshwari, and the other is Bennington MCQs.
Yeah, yeah. Those are MCQ
And
books. I have,
yes,
yes, yes.
also they cover good chapters,
Oh, yeah, true.
like very crisp. I also made very good notes from them. I think they are good notes. So
No,
I compiled them in one chapter, and I had revised the critical care part for 3 to 4 times. But whatever note I had taken, I revised them for 3 to 4 times. And the Harrison is too big. I also made notes from them. I import, I read the important chapters like heart failure, ACS from cardiology, arrhythmia from cardiology, stroke from uh, seizure from neurology, like this. Like those chapters, I thought that they could be high yielding given my last exam experience. And I have to also mention some resources by the Dr. Nishant Sagar, and then also by Dr. Rakesh Nair. And
Mhm.
also, I went through some notes for the major chapters. For example, ACS. I just read the Marrow notes. I think their crisp and can be revised in 20 minutes or something. So those are very high yielding.
Yeah, I think
And
everything.
also the explanation of the MCQs that you have provided, they are also good.
I think everything at the end of the day adds up, and I think it's also very important that you make your own notes, because at the end of the day, when you are in the final weeks of your exam, it's not possible to again go through the videos. So it's better that if you make the notes, it will actually help you in revising things faster. So that is a very important thing that you mentioned. So I think if I may ask you another question, so what are the things that we can do to improve, because we are providing this thing at the end of the day? only once we talk with you guys, we actually know what are the deficiencies. There are a lot of things that maybe we can improve as well in terms of critical care or in terms of the other subjects as well. So if you have any suggestions for us, we'd be happy to listen to you. So what do you think are the things that we can do more in terms of, not just in terms of like as a resource for an exam, but even because when I talk with my residents, even in my hospital, what I see is that a lot of residents, they're actually depending on these resources for the daily teachings as well, because they do
Yes, sir.
not have a very strong teaching program in their hospital. So what are the things that you would want us to do going forward?
I think, for example, handwritten notes are not there. I think they would hasten the process of our preparation or our daily basis. And then the notes for all the videos are not provided as of now. I think Mary will look into it, and also add more detailed question bank maybe. I think it's a nascent stage, and Mary will improve, but then I had to go back to other allied subjects to go through the MCQs. I'll mention, for example, arrhythmia, heart failure, seizure, stroke only, which are part of critical care. For that, I refer to other SS modules. But sometimes, due to constraints, time constraints, or some other issues, it, it's better to get it within one chapter. And also the frequency of tests. I think this is my personal opinion.
No, no, that's
I,
fine.
I would like to give 2 or 3 more small tests or GTs like before.
Yeah, because till now I have covered, like I've provided about 50, 60 hours of recording. But again, I also be honest with you, I have not completed the entire critical care. But I've tried to cover all those topics which are not being covered by the other faculty. So that at least you have a complete exposure to most of the topics. But obviously from a critical care perspective, maybe there are a few more topics that ideally I would also like to cover in the coming few months. So maybe if you have the subscription, you can um, continue to watch those videos. Uh,
Yes, I
so,
will continue to watch.
and so now you're headed to Rishikesh, right?
Yes, sir.
Okay. So Rishikesh, much better weather than Delhi. Hopefully,
Yes,
less air pollution, and nowadays Delhi temperature is kind of unbearable, and so you'll get a better air to breathe, and
yes, hope so.
hopefully better and a lot of places to visit actually. Like once you're in Rishikesh, you are like closer to the Himalayas, right? So I'm somebody who likes to travel. So obviously you'll also have that thing that you can travel and enjoy life while you complete your residency. So from Marrow and from everybody out here, we would like to wish you all the best for
Thank you,
your
sir.
future. And do keep in touch if you need any help, personal, professional. You can get my number from the Marrow Fellows, and feel free
Yes,
to reach out. Obviously, and try to get maximum exposure to both surgical as well as medical ICU, so that at the end, when you come out, you are a complete intensivist. At least you have exposure to everything. So again, wish you all the best and huge congratulations on your achievement. It was such a pleasure to talk to you.
thank you, sir. Thank you so much. And thanks to Team Marrow for creating such a fanboy moment again and repeating.
Nothing like that. Nothing like that. Thank you.